In Uganda, we saw what was called slim disease, and we challenged as healthcare professionals how to tackle this emerging problem of AIDS, HIV/AIDS. In obstetrics, we're caring for mothers and babies, and we're kind of saying, no, this problem is not with us, it's in the Department of Internal Medicine, because people were very small, falling sick, and losing weight. And we're relaxed in obstetrics. We thought we had no problem. And so we watched the people in internal medicine struggling with this disease for fishermen. But we took a bold decision that in Mulago, in Zambia, in Rubaga, and Arua and Gulu, we are going to find out if this disease is there even among pregnant women. And so the government of Uganda started surveillance for HIV/AIDS among pregnant women, 1987, 88, 89. When the results came out, it was a bombshell. By 1990, we had confirmed that 1 in 3 pregnant women was HIV positive in this country. Another bombshell is that we are not taking precautions. When we started looking at our health workers, we found that our midwives were having HIV. That was a shock. And at that time, I was in Mulago, 83, 84, 85. We used to rewash gloves. We used to wash needles and boil them. We didn't have supplies, so we'd make them last as long as possible. And that brings tears close my eyes. So my midwives, my dear midwives, working very hard, not only in Mulago, but many other facilities to wash these needles. Obviously, they got pricks. When we did the study, Professor Baragaini has emphasized the importance of research. We have to identify what's the issue here. We realized in terms of exposure, the nurses and other health workers perhaps would be more exposed than the midwives. We found the problem was handling these infected materials. Even though the problem seems to be clear that you can solve it alone, try to see if other people can make the results 100%, 110%. That's what it means to be multidisciplinary team, even for an obvious problem, even for a problem of an incubator in the hospital, even for a problem of getting more women on board. We must constantly be on that hunger and passion to bring other people on board. Always be on the lookout. So the classes we ran at the beginning were fantastic. This particular program, this physical interaction, is the core of training and formation. Because interaction with the students from Tanzania, from Rwanda, who had some from DRC, West Africa and so on, working different settings, that's what enriched the experience. That's what gave them the knowledge, and that's what spurred them on. And that's what was sustainable when they had left the university. They learned, they saw, they shared, they experienced. When they went back, you can witness and you can listen to the testimonies. And that's where I would like to end by saying that this program should continue, yes, but should bring back that physical presence. I found it very difficult in the last few years, especially after COVID, during COVID, to be able to make people experience that oneness and share in a way that when they leave the university and get the degree, what's sustainable is what they have experienced and what they have learned.